Hey, aloha everyone. I had knee replacement surgery on my right knee on December 3rd, and today is December 28th, and it's a Monday, and on Wednesday it will be 4 weeks since I've had the knee replacement surgery. And I've been treating my knee with Brown's gas by putting it in a cast cover bag and filling the bag with the gas, as well as I have a spot applicator that I use. And I put the gas on the muscles above the knee because after the surgery, the muscles get retracted. And when I started, the muscles above my knee were really stiff and hard. And you could probably bounce a quarter off the muscle because they were so tight. So I've been applying gas with a spot applicator on those muscles, and it causes those muscles to relax. So it makes it much easier to move about when those muscles are relaxed. And I've been doing the exercises associated with physical therapy on this as well. Now, I've had knee surgery on both knees now. And so I had my left knee done 7 years ago. And at 4 weeks, I was still hobbling around. And you could see how the scar is there from 7 years ago. It was a long recovery. It took 3 months before I was able to walk normally. And there was a lot of pain associated with it. And I thought this time around I have Brown's gas and I'll apply it to it because it reduces the pain and inflammation from the knee. And so I've been treating it every day, 20 minutes to an hour, both with gas in a bag as well as with a spot applicator on the muscles here above my knee. It has really vastly reduced the pain and inflammation. And my recovery is leaps and bounds faster than it was when I had the other knee done. And today I played pickleball for the first time this morning. Although I wasn't that active, I was mostly standing in place and trying not to stop and start, just playing easy. But I'm able to move in all different directions without any pain. And even after pickleball, there was no pain and there was very little swelling. But you can see the scar right now, and the scar looks fantastic compared to what it was with this knee at this time period. The Brown's gas machine I use is the one that I make. Call it the Aloha Brown's gas machine. And I'll turn it on there. And I also breathe the gas through a cannula. And I breathe at least an hour a day. And that also helps reduce the pain and inflammation from the knee. And you can see the gas bubbling here and coming up through the cannula. When I go to treat my knee, I put it in a cast cover bag. And I just put the cannula around my toe. And then I put the cast cover bag over and pull it up my leg. And then allow it to fill with gas for 20-minute periods at a time. After that, I attach the spot applicator to the gas. And I just put it on the muscle, and I hold it there with a strap. I have a D-ring strap here that just holds it on the muscle for 20 minutes at a time, and then I would just move it to different areas. Happy New Year, everybody. And I just wanted to report on those findings for my right knee replacement surgery in helping with pain and inflammation from the surgery. And it really, really helps. My knee recovery is much more advanced than it was the last time that I had knee surgery on my left knee. Aloha, everyone. I hope you enjoyed this video.